Hello, everyone. Welcome to Healthcare, Signs, and Symptoms, a show where we explore the interdisciplinary field of healthcare and medical research. Tune into the bi weekly conversation with UOHS as we cover the latest topics in science news. My name is Michelle, and today I am joined with Derek.
So today we'll be discussing the integration of technology into the healthcare system. And just remember, if you haven't checked out our blog, UOHS Journal, go read that right now before you listen, and you'll have a little bit of context as to what we're talking about. The first thing we'll talk about is how do we know if we're over depending on technology, and when is it considered too much dependence on technology? So as you know from our blog, it's been studied that Canadian family physicians are offering checkups through the phone. So instead of going in, you call up and then they'll talk to you over the phone. So that brings up the whole idea of like, is virtual care optimal, or is it better than normal care, or what are the pros and cons of virtual care, and why are they like that? So one really big thing about virtual care that's beneficial is it's cost effective. In Canada, we don't really have the issue of paying for medical checkups because of our healthcare system, but overall, there's still a cost associated with it, even though it may not be directly affecting you. So it's more cost effective to have a virtual checkup because it's quickly over the phone. It's more convenient because you can just call in whenever you have a scheduled time, but it's more convenient because you can stay in your house and you'll be in your like natural area. You don't have to go anywhere.
Yeah, like
Um,
especially with COVID right now, like being in your house, like that's ideal. So having like upgrading to this like virtual care, it's kind of like we needed it during this pandemic, right? In order to provide like care to others, we needed to be at home. So I 100% agree with this pro on virtual care and technology is that you can stay in the comfort of your house. You don't have to worry about travel time. You can wear your PJs, man, like and you can still have that care from a physician. And I don't know, there's always been telehealth actually, I think. I remember like I had to visit a clinic and I ended up talking to a physician through like Skype and
oh,
that was like pre-COVID too. But I think with COVID-19, it's kind of like it exploded because this was the only care that we could have because of COVID.
yeah. Personally speaking, from someone who during COVID I did have to do one of these call checkups, I will say it was significantly easier than walking in. But there was still like a time associated with it and a specific like range in which you can call. And I would say it's a little bit less uh, direct than when you go in because of course it's all just verbal and there's no video, there's nothing like that. I guess if you were on Skype in your example, it was through video, so it may have been a little bit easier. But yeah, in my case it was just through phone, so you really had to give very, it really relies on your ability to like explain your problems so that the doctor can make his best judgment. um
That you make a good point about like explaining verbally your health issues because like when you go into the doctor's office they check the temperature, like look at your tongue or like the ears, heartbeats.
yeah,
Like if you have like physical like conditions like on your skin or anything like that, they can't see it. I mean through video,
right,
sure, but I feel like that's a little bit. I feel like I would get intimidated just to like,
yeah,
I don't know. How about like birth, like pregnant women during this time? I mean, I think they go into the
right.
office alone to get everything, but like imagine like getting all of that care through the phone. I think it kind of goes to the next my the con in my opinion about technology is that you kind of lose that in person kind of personal touch you get when you get to see doctors like face to face. I think on both ends too. Like as a patient, you don't get that like one-on-one intimate like relationship that between a doctor and a patient. But then as a doctor, I feel like I would want to like get to see my patients in the
Mm.
face and like be there for them physically.
Yeah, I think also digitalization, like you described, for people that have more severe or more specialized cases, is a bigger problem because then it's not as easy to describe over the phone. And so that would kind of be pro for the general population because they have more common problems, so it's easy to check up on the phone, and so it would save them time. But again, for those people that need like specific types of care, it's really not optimal because then they have to expose themselves to potentially COVID when they're going to the hospital or just traveling in general,
Yeah.
and then they would already be at risk because of their problem. But I know that as everything digitalizes more and more, they are trying to increase the amount of specialists and physician access that you have available to you virtually. Because, of course, I think they realize that that's a problem for these people that need specialists. What they've been doing is they've been increasing the amount of specialists available on the phone. And so you can call up and basically schedule an appointment and then be referred to a specialist like you would in a normal hospital. But instead of having to go in, they would have these specialists on the phone. And another thing that's kind of related to that that's really important is patient engagement. So a lot of times, if patients either they'll be too lazy to go in or they won't feel comfortable going in, especially with COVID-19, that decreases the amount of patients that I guess would be engaging with the hospital that are in need of care, but just don't get it. So if you have a alternative means of getting that care or at least starting to get the care, then the amount of patients that will potentially take that care will increase. So that's a really big advantage of virtual care. Again, it's just going around the roadblock that COVID presented.
I mean,
Um,
I think what you're pretty much saying is accessibility.
right.
Like, accessibility increases for patients. And
Yeah.
I think that's really, really important for especially COVID-19 right now. Obviously, there's like financial issues, not wanting to go out, and virtual care offers that resource and that accessibility for people who might not have it right now and can still get that care if they need it.
Right.
That really
Yeah.
does bring up the question, though. You mentioned like patient engagement, specialists, and we've all like the in person stuff and specialized cases. Do you think these virtual care appointments are just as efficient and provide quality care as in person?
Well, like, there's a lot of factors to consider when answering something like that, and I definitely think that it's in some ways it is more efficient, but there's ways in which it wouldn't be as efficient, such as you would first have to retrain all the staff because most of them would be trained medically to do in-person analysis and in-person diagnosis. So one step of virtualizing would also be setting up your staff as a hospital manager to like to be able so that they can do their jobs online because that's not what they were trained for. Of course, they'll have some knowledge that will transfer over, but you need to implement training techniques and training courses for your staff, and then also in terms of the people that will be going to get a checkup online, for example. Uh, most A lot of people will just have, for example, they may not have the most reliable internet or they may not have the most reliable technology, so a big thing that can come up is technical difficulties. And you can imagine when you're trying to get healthcare, you really that's the last thing you want to do. You want to figure out what's wrong with you and you want to figure out how to fix it. And so if you have to deal with your Wi-Fi or you have to deal with your phone not working, you can see that that wouldn't really be very optimal. So
I 100% agree. Yeah, like that it is not optimal and the retraining is so important, learning to troubleshoot and like become patient with technology and hoping to God that your Wi-Fi goes back on. And I feel like there's also a part where you don't communicate as well. Like maybe they, because of those technical difficulties, the message of the diagnosis or the treatment doesn't go across properly, which can
yeah.
affect treatment.
Yeah, that also brings up like the question of language barriers. I know we live in Ottawa, so it's a pretty multilingual place, and or sorry, it's a pretty bilingual
Well,
area. So uh, it's most people will have no problem with this, but there's always the issue in that little subset of people that may not speak both languages or may speak a different language. Um, so those people may have problems with their checkups virtually because there's always a limited amount of people that can check you up virtually, like the limited amount of doctors. And there's nothing to say that those doctors may not speak the language that you speak or may not be able to understand it as well. And so then that can really pose a problem when you're trying to explain, and especially a virtual system where it's really reliant on how well you explain your problem. If there's a language discrepancy or there's any form of gap and the doctor may not understand you as clearly, that can become detrimental to the healthcare you receive. And it can also become a very big problem in case you get improperly diagnosed because of a misunderstanding.
Yeah, the improper diagnosis is such a great point, especially with language barriers. I think again, it's we're talking about minorities. We're talking about um not like people not having that. And when it comes to healthcare, it there's a lot of pressure of giving the proper treatment, giving the proper diagnoses. And with virtual healthcare, that risk rises, in my opinion, because of those factors. So communication, literally, doctors are going to have to. Obviously, they're already great communicators, but like transitioning onto a virtual platform, those skills are going to change. And even as a patient too, your communication skills have to change too. Like we said, like verbally explaining what's going on. And I think it definitely means that our conversations virtually are different.
Yeah. And I also think something that's important to consider like that is the less people you have. Of course, you'll have pretty big selection of doctors that'll be available, but the less people that you have calling in, the better availability those doctors will be for the people that are like seriously in need. For example, if someone has a little problem with their toe and they would call in for that, or if there's someone that has a more like threatening condition, like they feel like they might have appendicitis or something, um, if the phone lines are clogged, again, hospitals try to prevent this, but if the phone lines are clogged, then they're just clogged. So I think another important thing is to have maybe non-direct communication ways in which to know if you're maybe exposed to COVID-19 or if you have some other form of potential problem that you don't need to call in for, because that would reduce the kind of stress on these lines. So I know, for example, China has a mandatory quarantine app which will show you your identity, your location, and your health status. And again, that's kind of useful in terms of knowing where you stand between COVID and if you're at risk.
Mhm.
Canada has something similar with their exposure notification app.
COVID
But
alert. Everyone listening, please download COVID alert. Help the population. This is not about you. It's about others. That's my little promo. Download COVID
yeah,
alert if that's the only thing you get from this podcast.
yeah. And one thing that COVID Alert does a little bit differently, or at least the Canadian systems than the Chinese system, is the Canadian systems will keep your identity private,
Yeah.
and they'll keep that all confidential. With China, there's a lot of security problems and confidentiality problems, so people might not be as inclined to use it. So again, yeah, please download the app. So the thing is, like, with China, it's maybe more specified to you and there's more information available to you. But again, that's at the cost of your privacy. And then with Canada, there's maybe less available information, but you're still notified if you've been in contact with someone
Hmm.
or if you may be exposed. And then your privacy is private. So each one has kind of opposing benefits, and it really depends on what the general population ideas are on it.
Yeah. I think definitely in this, for us, I definitely in the Western society, I think privacy is a huge thing for us. So I definitely would prefer like privacy. And I think
Yeah.
society kind of stands for that as well. Honestly, I wouldn't mind seeing like an update with our COVID alert app, adding a little bit more information, just to like use this as statistics too. Um,
Right.
I think that would be really, really beneficial for Canada to get better, stable, accurate, precise, valid statistics on this pandemic. There's a whole part of this population that is asymptomatic, but may be actually spreading COVID. And there's also like, we don't get tested, and maybe you are spreading it, and then that doesn't show up on the app.
Yeah.
So I think there could be some add-ons to this tracing, contact tracing app.
Yeah.
Um, Also, I
Like,
think it also adds to like, what if you don't have a phone, a smartphone?
yeah.
Like people who are in a lower socioeconomic status could be at higher risk because they don't have access to this app to tell them that, hey, you've been in contact with someone with COVID.
Yeah. And so I think that that like ties in with, making everything more accessible to people, and kind of you have to figure out a solution, a creative solution that would work for all people, because if you just have something that requires your phone, then it may be very selective towards people that are able to afford phones, and
Hmm.
then it kind of indirectly disqualifies a different kind of class. Um, and so I would
Different
say
groups, yeah.
yeah. So I would say I prefer the Canadian exposure app type, because I think privacy is something I really value, and I think people should value it, because
100%.
as everything digitalizes, that's decreasing more and more. So I think you need to like keep your my sorry. I think you need to um, keep your stance on that as strong as possible to not let companies take that away from you. Um, so again, that that's kind of all dependent on if you have a smartphone and if you're able to take part in this or not. For the people that aren't able to take part in it, again, they're just at a disadvantage, which is bad, because this is something that's affecting everybody. COVID-19 doesn't choose people to go on it. It's just a virus. It'll go on anybody that it comes in contact with. And it'll affect anybody that comes in contact with. So there should really be no difference in lower socioeconomic status people being able to test and diagnose each other, or being able to be tested and diagnosed, versus people of a higher socioeconomic status. I think it shouldn't matter what status people are at. That determines what healthcare and what healthcare they can't receive.
Hmm.
So
Healthcare, it's a human right.
yeah,
Everyone deserves it, even like those minority groups. And the digital, like the transition to digital healthcare that was kind of pressured through this pandemic really highlights healthcare inequity. And through not having a smartphone or a mobile app to track it, through bad Wi-Fi connections and having like good virtual care. So yeah, I 100% agree.
yeah. So I think, yeah, again, that's what people need to kind of be working on now, is figuring, now that they've implemented like a base system, they need to figure out how to kind of spread that system so that it encompasses a wider variety of people that can use it.
Mhm.
And then
Outreach.
again, yeah, outreach.
Yeah.
um, so I think that's basically the gist of the blog post.
Yeah.
Do
Any
you think any?
conversations that came up while we were talking, leave a comment. This will be on our Instagram. Leave a review on Apple Podcast or wherever the heck you're listening this from. We want to know what you're thinking about this conversation. Um, a lot of things came up, and we only have a short amount of time to talk through everything, but we would love to have these conversations for longer. But yeah, leave a comment, leave a review, like and subscribe.
And remember to stay tuned for next week's podcast. We'll be talking about the politicization of science.